Hi, Rachel from Scoliosis Clinic. Welcome to video 3 in our series on x-rays. Today we are going to talk about growth plates in different ways that they are measured from x-rays. If you're an adult, this doesn't really apply to you because you're skeletally mature. But for those of my clients and interested people watching this video, if you are a kid or a parent of a kid with scoliosis, knowing where the child is in growth is very important in determining what treatments are going to be appropriate and most effective. So there are two main ways in America that doctors assess where an individual is in their growth, and they are the Risser sign and Sanders stages. The Risser sign is older and it's more commonly used, so we'll talk about that first. I'm going to pull it up so that you can see it. Okay, so this is the same as my painting here, but I added some extra features. When we are talking about the Risser sign, that is a measure that assesses the growth plate closure of the top of the pelvis, and it shows on both sides, but I've got different stages here for you to see. Before a kid starts growing and after a teenager is done growing, the Risser sign will look the same. A 0 and a 5 both look like just one flush closed pelvic line. Okay, but in between Risser 1, 2, 3, and 4 appears this white line that comes above the pelvis and starts to creep across. So Risser 1, you'll just see a little bit on the edge. Once you get to about 2, you're in here. 3, you're almost done. 4 will be a white line completely covering the top of the pelvis. So once the child is mature, this line above the pelvis will completely fuse. And so that's why 0 and 5 look the same. But you can kind of know if someone's a 0 or a 5, depending on their age and if they have physical signs of puberty. If I have an 8-year-old that's really short still, and they have just this flush line, I'm going to say they're probably a 0. If I have an 18-year-old that's pretty tall, has gone through puberty, there's a flush line, they're probably at a 5. So it's really important for us when they're in the 1 to 4 range. This is where 0, 2. If you're a 0, 1, 2, 3, 4, there's still opportunity to do things. The farther along you are, the closer you are to being finished growing, there's less that we can do, because most of the measures we do for kids that are growing, bracing, the modulating surgeries that you might have heard about, Schroth therapy with the intention of correcting the curve early, those all have to do with trying to guide growth. And so the more growth you have left, the more potential you are to guide it in the right direction. So that's why the Risser is so important, and the Sanders that we'll talk about in a minute. The Risser is nice because you are already going to see the pelvis when you take an x-ray of the spine. And that's why it's used commonly still. I believe it doesn't require a second x-ray, but we're finding that it's not the most accurate. I've seen some studies that say that it's only accurate 75% of the time. So that means that a fourth of the time we don't predict correctly how much growth is left. So that's why there has been some move to a new measure, which is called the Sanders. I don't know as much about the Sanders, but I'll let you at least look at it a little bit. The Sanders staging for growth looks at growth plate in the hands. So if you're a 1, you are skeletally immature. You have not started growing yet. 8 is when you are finished. If you look at the 1, all of your phalanges have little unfused parts here. So as you move along from a 1 towards an 8, different phalanges fuse at different rates. So in between, in the middle range, is kind of your 2 through 6, I think, is kind of the sweet spot for working on scoliosis correction. And the Sanders, the downside is that you have to have another x-ray. Sometimes I've seen hands up like this in a scoliosis x-ray to try to get both of them in there so that you don't have to do multiple x-rays. But I'm seeing a lot of doctors moving towards this because it's a lot more accurate in predicting when the peak of growth is going to be and how much there is left to complete. So those are a couple little tidbits about staging. It's important to know where your child is in their growth plates, because the severity of the curve plus the stage and growth kind of, they come together to tell you what your options are, how likely you are to succeed, how likely it is to progress, and what's available to you at that given moment.